rise also in strong support of SB 106. The women's health centers supported by the investments in this bill provide essential life-saving care, including cancer screenings, mammograms, STI testing, pregnancy counseling, and comprehensive reproductive health services for women and young girls. These services are especially critical in rural California, like in my district. In communities like Madera, Chowchilla, and West Fresno County, women already struggle to access basic health care, particularly expecting mothers. In many of these regions, Planned Parenthood, yes, I said Planned Parenthood, and similar community clinics are the first in line of care, especially where primary care providers are scarce and non-existent. In fact, I just learned this just a few hours ago from Merced County Department of Public Health. They rely on Planned Parenthood for STI testing services. That is not political. It is a public health reality in my community. Federal actions have already taken a devastating toll since the passage of H.R. 1. California has lost 15% of Planned Parenthood's healthcare workforce just since last summer. We went from 28 full-time health educators statewide to just 5 today. These are not abstractions. These are real providers serving real women in our communities. Those cuts have already led to clinic closures in my backyard, including Planned Parenthood Clinic in Madera County. This is unacceptable. And let me be very clear on this point. As many of you know, less than 3 weeks from the day that I was sworn in to represent constituents of Assembly District 27, I learned of Madera Community Hospital's intention to close. Since that day, I made reopening Madera Community Hospital my #1 priority. Thankfully, with the help of many of you in the governor's office, we established a loan program, and we not only reopened Madera Hospital in March of last year, but we also helped other struggling hospitals across the state to keep their doors open. Now the challenge for Madera and countless other hospitals is keeping their doors open in light of federal actions that are destabilizing our entire healthcare system. That is what is happening as a result of H.R. 1. So shame on my colleague from Clovis for trying to pit hospitals against women's health clinics or that attempt to restrict care based on ideology rather than medical need. That approach does nothing to strengthen rural health systems. It only weakens them. SB 106 is about stability. It is about ensuring that women do not lose care first, because often when budgets are cut, women's health services are the first to go. Unfortunately, we are fighting not only the consequences of H.R. 1, but also misinformation being spread about what this bill does and who it serves. Let me be clear. I welcome bipartisan collaboration on policies that genuinely improve access to healthcare in rural California. But do not mislead the public by claiming concern for one narrow issue while constantly voting against women's health, workforce investments, and access to care. Everyone in this room has a mother, a grandmother, a sister, a daughter, a niece, or someone who they love who depends on a functioning healthcare system. This is not complicated. This is not ideological. This is basic common sense healthcare policy, and I respectfully ask for an aye vote.